A big hi to all the nursing government job aspirants and welcome to Nursing Career Updates. While your preparation and before appearing for the exam, everyone will have many doubts and many questions in their mind about preparation. What subjects have more weightage marks and which subject has less weightage marks? How can we prepare and which subject we can skip and what is the process? These type of questions will lead all the people delay in the starting of the preparation. Here I'll tell you how to do. NORCET exam include questions from all the subjects, but our major subjects are medical surgical nursing, OBG, community health nursing, pediatric health nursing, and psychiatry health nursing. These major subjects have more weightage in exam. Many questions are asked from these questions. So obviously, more weightage marks are in these major subjects. Our minor subjects are like nursing management and administration, education and technology, research and statistics. These subjects have less weightage marks. So we'll go through all these subjects now and how to read and how to plan for these 6 months. What we have to do is first complete all the major subjects. This medical surgical nursing, OBG, community health nursing, pediatric health nursing, and psychiatry. Medical surgical nursing includes all the systems of our body. Spend at least 30 days for this to complete the subject. Complete this subject in each book, like theory based questions and memory. Remains memory based questions and practical based questions like NCLEX. Theory based questions you can read from Target and PR Adab, and clinical questions you can read from NCLEX books. Compare each question with this basic theory. While reading the question, go through the theory of that topic and also each option they mentioned there. And here in medical surgical nursing, if you're aware of and if you gain knowledge on all the systems of our body and all the topics of medical surgical nursing, you will have grip on the medical subjects. By that you can easily compare and read all the other subjects and community health nursing or pediatrics or psychiatry, whatever the subject. If you have the basic knowledge of the medical subjects, the first subject is medical surgical nursing. If you have basic knowledge on this, if you have grip on this subject, you can easily go through all the subjects. So completely focus on medical surgical nursing first. The important topics in this subject are cardiovascular system, respiratory system, endocrine system, gastrointestinal system, nervous system. These topics are very, very important. And first, try to cover these topics, then cover the remaining topics. Our next major subject is OBG, obstetrics and gynecology. For this, you have to spend 25 days for preparation. In the subjects, they are going to ask directly or indirectly. This subject has scope for both memory based and clinical based questions, so we have to prepare well of memory based and clinical based questions. Our next major subject is pediatric health nursing, and this pediatrics is very similar to medical surgical nursing because the system topics everything is similar, but few differences, few variations will be there in adult and children. So you have to remember and differentiate those variations. Other than that, this pediatrics and med surg is similar. So you need only 15 to 20 days for preparation of this subject. Next is community health nursing. Community health nursing is not based on our systems. Body wise topics will not be there in this. The main topics in this are like programs, health programs, policies, and health resources and vaccinations, committees in India. All these are come under community health nursing. So you need to spend 20 days for this. There will not be any clinical based questions in this subject. You will have to remember all the topics and all the numbers and names of these plans and programs, immunizations, vaccines. So questions in this subject are all of memory based questions. Our next major subject is psychiatry health nursing. Psychiatry health nursing needs 25 to 30 days for preparation because while reading you may get confused or you may feel very different from regular subjects. So spend 25 to 30 days for this subject to gain grip. Here both memory based and clinical based questions are asked. Questions in exam would become tricky if you don't gain knowledge on this during your preparation. Next, our minor subjects which have very less weightage of marks. Those are nursing management and administration, education and technology, research and statistics. For these subjects, you need to take only 10 days of time for preparation because these subjects have very less topics and very easy to remember, and these subjects will be covered for one or two questions in the exam, but don't neglect thinking that only one or two questions will be asked and one less weightage of marks are there, why to read like this. Don't think like this and don't skip these subjects while your preparation, because even one or two questions are very important to score high marks and to get good rank. So cover these subjects. You can focus these subjects within 10 days. You can complete the subject and you can gain the knowledge of these subjects. This include all the memory based questions. We'll go to the next topic. The other two subjects with minimum marks are genetics and microbiology. Even these two subjects we can complete very fast because very few topics are in this subject, and the topics in this genetical disorders and communicable and non-communicable diseases differences and variations. The other clinical topics out of these subjects are OT, operation theater, anesthesia and image based questions. In regarding operation theater, they'll ask about atmosphere, temperature, arrangements and staff. Regarding that, related to anesthesia, they'll ask about medicines, types of anesthesia, and even that ventilator anesthesia mission. And regarding image based questions, here they asked about equipment and instruments used in the hospital and during procedures, different procedures that are done for the patient. These questions will be covered. The questions on these topics are also very important. Next, non-medical subjects are general awareness and maintainability. Here, they'll cover about English, general knowledge, maths, reasoning. These topics are also important. They cover almost 20% of the questions in the exam. Spend at least 1 hour for these subjects daily. General knowledge is a vast subject. You need to cover more topics. So first try to cover mental ability, English and reasoning. And these subjects spending for 1 hour daily you can cover and you can almost get good score in this. The topics among these subjects will be given in the next video, and keep last 1 month for revision of all these subjects, and revision is very important. After reading every subject, recall the things, recall the topics for every time whatever you read. Last revision, that is revision before your exam is very important. It will play a key role in your exam. Because of this you can gain more marks, and don't skip revisioning the subjects. Whatever you read, keep revisioning. By that you can remember well, and you can gain good marks in the exam. Don't try to read or learn the new topics before your exam. All the best for your upcoming exam.